Hello, good morning. This is Anita, one of the OET trainers at Talents Academy, and today I am going to discuss a role play card with you. And the setting is hospital ward. You have been called to the patient's bedside. The patient was supposed to go in for a surgery at 10 o'clock, and he was the second on the list also. But the surgery was delayed because the previous patient had some complications during surgery. He had never had an anesthesia before and was suffering from post-op vomiting and had not passed urine and is in severe pain also. And the patient's daughter is very angry and wants to talk to you. So here you are talking to patient's daughter. So the scenario is the patient was supposed to go for surgery, but the surgery is delayed and his daughter is very angry with you. Okay, your task includes find out why the patient's daughter is angry, empathize with the daughter about the delay but be realistic about how long the patient may have to wait, explain why the operation is late and try not to blame theatre staff but explain post-op complications can be unavoidable. And the last one is negotiate with the daughter to prevent her from insisting her father is discharged. Okay, so here you have been called to the patient's bedside. So when you start the conversation, you can start with, "Good morning, my name is Anita. I'm the registered nurse in this hospital. Did you press the buzzer for me? How can I help you, Mr. Bijli?" Okay, so here since you are talking to patient's daughter, the patient's daughter might answer like this: It was not him. It was me who called you." So here you have to talk to the daughter. But before you talk to the doctor, you have to get permission from the patient to discuss his health problems and treatments with the patient's daughter. So you have to ask patient, "Mr. Bijli, is it okay if I talk to your daughter about your treatments and diagnosis?" Okay, and if the patient agrees, you can proceed. Okay, so here I hope the patient agrees because you need to continue with your talk. Okay, so if the patient agrees, first you need to ask the patient, ask the daughter's name. So how may I address you? Before I proceed, I need to know your name so that it would help for a better communication. Okay, so the patient's daughter is very angry, so she might not answer your question. If she doesn't answer, then you have to tell her that it's very necessary or it's essential that I know your name because it helps me for better communication. Okay, then the patient's daughter might say, "You can call me Maria." Okay, so here the first task is find out why the patient's daughter is angry. So you have to ask the patient's daughter, "It seems that you are quite angry with me. What happened?" Okay, so the daughter might answer, "So this is my father. He was supposed to go for surgery at 10 o'clock and it's already 11. And why he is still here? I don't understand what you people are doing here." Okay, so see, this is a valid concern from patient's daughter because he was supposed to go for surgery. So here you can tell the patient, "I understand it must be difficult for you to see your father going through such situation, or it must be frustrating for you because you have been waiting for the surgery. So I apologize for the delay because we had a patient who never had any anesthesia before and he was on the first list. He was just before your father. So because he never received any anesthesia before, he had some post-op complications such as vomiting and he could not pass urine and he was suffering from a lot of pain also. So that's why your father's surgery is delayed." Okay, so here when you answer this way, the patient's daughter might say, "Oh, that's not my father's fault. You should have expect all these complications and you should be prepared well. You should be well prepared to treat all these complications. Okay, that's not my father's fault." See here, you have to explain to the patient's daughter again why the operation was late. So, and you should be very careful not to blame the theater staff also. So here, you have to again tell the daughter that I apologize for the delay. I'm so sorry for the delay, and I know it was our mistake. But as I mentioned earlier, that patient never received any anesthesia before. Always we prepare for such complications, but since that patient did not have any anesthesia before, we never expect such complications. So he was so serious also. So that's why the theater staffs were very busy to treat him. And your father is the next one, and he will be transferred to the theater within half an hour. Also here see, it's written that but be realistic about how long the patient may have to wait. Okay, so you have to tell the patient's daughter, like within half an hour your daughter will be shifted. Do not say within 5 minutes, because see here in the task it is written be realistic. Okay, so within half an hour your patient, your father will be transferred to the theater. Okay, then the last task, negotiate with the doctor to prevent her from insisting her father is discharged. See here, the patient's daughter might not agree with whatever you are saying. She might say, I don't agree with you. I don't think his surgery is an important one. If so, you could have transferred him for the surgery by now. But he's still here, so I don't think that's quite important for him. So I'm going to take him home. So the doctor is going to discharge the patient. Okay. So here you have to explain about the risks and benefits associated with not having the surgery. Okay. So first you have to tell the benefits of doing surgery. So tell the doctor that, say, I understand your concerns. I understand it might be frightening for you, but still your father's surgery is an important one. See, he is suffering from a problem, and if you don't treat it, if you don't do any surgery, he might end up with having some complications. It can be fatal for him. So please stay in hospital and agree with the surgery. So you can explain the benefits. See, like I said before, say the surgery is the best option for your father's problem. There is no alternative. So this is the last option, or this is the best option, and please give priority to your father's health. Don't go home. If you go home, it can cause major complications to his vital organs. It can be fatal for him. It can cause some adverse effects or detrimental effects. Okay, so explain the benefits and risks associated with it. Okay, so when you explain these risks and benefits, the patient's daughter might agree with it. Okay, so here the patient's daughter says, okay, all right then, but make sure my father is transferred into the theater within half an hour. Okay, so finally, the daughter agrees with whatever you are saying. So if the patient's daughter agrees with your instructions, then thank her, or I appreciate your decision, or I'm glad to hear about your decision. That would definitely help your father to have a speedy recovery. Okay, then finally you can give a leaflet to the patient's daughter if you want. Like say, I'll give you a leaflet for you. It has all the information about your father's surgery and the post-operative care also. So you please read it, and if you have any queries, you can always ask me. I will be at the next station, and if you need any help with anything, please press the buzzer for me. I'm happy to help you, and I'll make sure that your father will be shifted to the theater within half an hour. Okay, so this is how you are going to deal with this patient. I hope you understood everything about this patient, and thank you.